Hello, this is Health Education 101. So, who am I and why should you take any type of advice or information or knowledge from me? So, my name is Nakia. I am a certified health education specialist. My background is in health promotion. I got my bachelor's in health promotion from the Indiana University of South Bend in May 2020. Um, this is, of course, during the COVID-19 pandemic of 2020. So I could not walk across the stage. Nevertheless, the pandemic has helped me excel in my career a little bit. Upon graduation, I became a contract tracer with the Indiana Department of Health from May 2020 up until August. At that point, I got a better position with the CDC Foundation, which is actually in collaboration with the Indiana Department of Health. And I became a communicable disease investigator. I still dealt with COVID-19. It was just more of a data point. The behind the scenes more. I didn't talk to anybody. I just investigated cases, confirmed cases, and collected information about those who have COVID-19. So I do kind of an epidemiology type of work. Before I graduated with my bachelor's of science in health sciences with a concentration in health promotion in May. I got my associate's degree from Ivy Tech, and that was associate's in general studies. And prior to me graduating from Indiana University South Bend, I worked in numerous hospitals in Michiana around the South Bend area. So I have a medical background and relatively a new public health background, and I became a certified health education specialist in May 2020. I'm sorry, October 2020. So my bachelor's of science was in health science with a concentration in health promotion. And there's so many different things you can do with a health promotion degree. You can do the public or tax supported agencies route, which is like a wellness coordinator, health services coordinator, tobacco cessation coordinator. There's hospital-based roles like educator, health loss coach, health benefits coordinator, pharmaceutical type area, which is like the medical equipment, pharmacist, health coach, which is mostly for private corporations, private nonprofit organizations like volunteer coordinator, and then of course like the federal government, in the state government, and then local health departments is also something that you can look into with a health science degree. So as a certified health education specialist, we have 7 different responsibilities. The first one is conduct a needs assessment, see what the community is lacking and how can we better serve that community. Then we're going to plan our program based off what the community needs are. Of course, if the community needs more walkable sidewalks, we're going to do that because that's what they need. And our goal is to help the communities become better communities, become healthier, and give them resources that they're lacking. After we plan, we are going to implement the health education program, strategies, intervention. After we implement, we are going to evaluate our process to see how it's going, and then research related to health education. After we research, we're going to serve as a health person, a health resource person in a sense. So being that person that is going to give that community what they need. Far as that resource, we're going to connect them to that resources, whether that be food pantries, insurance like Medicaid if they don't have any insurance, and then last but not least, we're going to promote and advocate for our profession, which is the health education profession. So we're going to promote it because it's a great profession. You're helping people, and we're going to advocate for what we do and become an advocate for those who are in need. whether that be lobbying or contacting legislators about programs that could benefit the community. So those are 7 area responsibilities as a health education specialist. So the health education specialist, also called CHES, CHES, is certified through the National Commission for Health Education Accreditation. And that is a national certification. So you don't have to get certified like in Indiana and then go to Illinois. It's no matter where you're at, you're certified as a health education specialist. So now we're going to talk about health education. So what is health education? So health education is teaching of behaviors that promote wellness. They develop and implement strategies, like I said earlier, to improve the health of individuals and communities. And this also can be improving the health of a profession, like a wellness coach in a factory. It's going to help improve the health of that facility, the staff that work there. So there are 3 different levels of prevention in health, and that's what we're going to talk about today. So there's primary prevention, secondary prevention, and tertiary prevention. Totally different, all kinds of different levels. So primary prevention is going to focus on diet. Let's see, I can move myself. Maybe I can move myself later. They're going to focus on diet, physical activity, emotional and spiritual wellness, and sexual behavior. Primary prevention is the less expensive method. So primary prevention is going to be begin screening for a mammogram. It's going to be like genetically begin screen for like to see if cancer run in the family. That's kind of like a primary prevention. Like if something develops, or I know if something develops, I can stop it or take precautions to prevent it. Primary prevention is the cheapest form of health education prevention. And primary prevention is going to be like health education. A certified health education specialist going into that community and letting the community know, hey, you know, tobacco causes this, this, and this. That's primary prevention. It's the cheapest way overall, and it's basically what public health is. Public health is, in a sense, primary prevention. We are trying to stop something before it happens. So secondary prevention is going to be screening, such as diabetes screening, STI screening, HIV screening, BMI measurements, mammograms, and preventive exams. For instance, STDs screening is secondary prevention, but using a condom is primary prevention. You're preventing that from ever occurring. Secondary is when you are, using a condom or like not having sex is going to be primary prevention. If you are exposing yourself to STDs by having sex and having unprotected sex and having sex with multiple people, that is going to be your secondary prevention. That's the same with HIV, whether that is having unprotected sex, not using a condom, or sharing needles. That is going to increase your HIV chances, and that is secondary prevention. And BMI measurements. That is secondary prevention. What's going to be primary is you eating healthy and you exercising regularly. That's going to be your primary prevention. Diabetes is the same way. Eating healthy, eating less sugar and salty foods is going to be your primary prevention. Secondary is going to be getting screened for diabetes. The same thing with high blood pressure. Lowering your salt intake and your unhealthy food intake is going to be primary, and then of course secondary is going to be like getting screened for high blood pressure. So we're going to talk about chlamydia, because chlamydia is one of the leading cause of STD, one of the most STDs impacting like 15 to 24-year-olds. So it is recommended that those younger population get screened for. It's going to be recommended that those younger populations get screened for STDs because they're more susceptible for it, because they engage in those high-risk behaviors such as having multiple partners and engaging in unsafe sex. So chlamydia. So get screened, you find out you have it, you get a single dose of medication, you treat it. Or you get screened and you don't get screened, You don't get screened, so you don't know you have it because you do not get screened. And that untreated chlamydia can cause infertility. You can pass it on to other people, and it can cause pregnancy complications if you do become pregnant and you still have chlamydia. So tertiary prevention includes rehabilitation, such as medicine. Again, you're getting screened, which is secondary prevention. Okay, so you have unprotected sex, so you don't use a condom. That's primary prevention. You don't use a condom. You get screened, which is secondary prevention, and you have chlamydia. And then tertiary prevention is you taking the medications to treat the chlamydia. So tertiary prevention is rehabilitation, such as medicine, to prolong life or decrease your chances of spreading it to others, and physical therapy. Those are all tertiary prevention, such as you get it. Okay, so you are driving a car, you have an accident, and your leg is broken. You have to learn how to walk. You need physical therapy. So physical therapy is going to be a tertiary prevention. And say you drove and you got hurt because you didn't use the seatbelt. Your seatbelt is going to be your primary prevention, which was not there. So now we go down to secondary, which is mostly screenings. You went to the doctor, they screened your leg, and your leg is broken. That is screening is that's going to be your secondary prevention. And then that leg is broken, you have to get it physical therapy to help with the leg, and that's going to be a tertiary prevention. So this chart, I got this data, and it really explains like cancer treatments, secondary cost versus prevention cost. Versus tertiary cost. So again, secondary is going to be like your screening. So mammogram screenings, most insurance covers it. It really doesn't cost you a thing, maybe like a $25 copay. Okay, so that is secondary screening, which is relatively cheap, like $20-30 for a copay, because your insurance most likely covers it if you have insurance. But even if you do not have insurance, that's way cheaper than the total cost of cancer treatments, chemotherapy. So that's the cancer treatment cost overall in 2014. That number is a lot compared to someone getting screened for it before you get to that stage 4 cancer, stage 3 cancer. So this chart really shows the cost of how important secondary prevention is. Tertiary prevention is like the last cause, but that's the most expensive because you waited all this long, because you bypass primary prevention and you bypass secondary prevention by not getting screened early and not seeing the doctor regularly. So you come up to tertiary prevention, you have this huge medical bill because it's so expensive to get it treated. The same, like, we're gonna go back to like the STD thing. Condoms can be expensive, but there's a lot of clinics that offer free condoms, especially if you're getting screened for STDs, those type of clinics. So, okay, you get a condom, right? You use a condom, you're good. Say you didn't use a condom. Now you have to get screened for STIs. And that's a copay. Say that copay is like $50. Okay, so now you're a little more in the hole. And then you get treated if you have that STD, which costs you another few, like a $20 or so, depending on if you have insurance or not. And you can see like condoms, which is a few bucks, is way cheaper than getting treated for chlamydia. You have that screening cost and you have that medicine cost. That's gonna go in part of the huge picture, which is those two costs, that like $50 copay, and then the medicine is gonna be way bigger and more expensive than that condom, which are gonna cost you low for money and stress, and like the whole thing is like less stressful, less expensive than getting treated for chlamydia, having to tell your partners the emotional part of it, the stressful part of it, and the economic part of it. You're spending money and it's costing you way too much if you would just get screened or like wear a condom. So I have a scenario. Okay, so a patient has recently been diagnosed as obese, and the doctor recommended exercising and change of diet to reduce the weight gain. What kind of prevention is this? So it is not primary prevention because the person has already been diagnosed as obese. It's not secondary prevention because he already got screened. He has been recently diagnosed with obese, and doctor recommended exercising. So it's not screening. The right answer is tertiary. So exercising is kind of like, it's rehabilitation. You're trying to like reverse, make that person somehow like eat healthier, lose weight to control their weight so they don't gain more weight. But even if that person is not obese any longer, that person is still going to be overweight. And that's still going to be an underlying factor no matter what happens with that person as far as their weight loss and their eating healthy. There's still going to be a possibility of that person becoming obese again, especially as they get older and the body metabolism slows down. Okay, so these are my references. On one side, I got my information from American Cancer Society, the National Commission for Health Education Credentialing. That is how I got my certification. And then resources, I'm going to list my website, the www.imhealtheducation.org. The CDC website has the greatest up-to-date information, and National Institute of Health. All right. Thank you everyone for listening, and I'll be back with more videos soon. I'm going to explain a lot of the aspects that comes into like health education and how certified health education specialists determine how to help a community or population and what resources that we have. And I'm also going to share my chef's tips on how I passed the health education specialist certification the first try. Thank you guys so much. Bye.